Dr. Zeudiann Coleman. If you don't know, I am a chiropractor, a holistic chiropractor, and my office is in Conyers. And so we've come together as a collaboration as two Black women, you know, who are very passionate about our community, about our people, and how to get them well. You know, because we understand what we're going through, especially in these times. There's a lot of things going on, unanswered questions, things that we don't know what's going on with our body, and so it's important that we have objective findings, not just, you know, I feel this, it's you know, it's not something you think of. It's something that, you know, the computer, well, it's called biofeedback, which is going to give you an exact information of how your body is functioning. And I'm so excited about sharing this time with you guys, because I know Sharon, she is going to break it down to you. When you're done, you're going to be ready to find out, you know, how is my body functioning? Am I physiologically older but chronologically young? You know what I'm
Yeah.
saying? You know, how do I make sure those two things are balanced? We can be, you know, in our 20s, but physiologically we're like 50,
Yep.
you know, and then you realize, why am I so tired?
Yeah.
So, you know, it's important that instead of troubleshooting, you know, buying vitamins and buying all these extra stuff that you might not need, because you know, you're not addressing the right things. So this will fine tune your holistic approach to your health, and not only save you money, save you time, but give you the results you need.
Yeah.
So that's all I can say for now. I'm glad that you guys are on,
Yeah.
and so I'm gonna step away and let some knowledge flow.
Well, thank you, Dr. Z. Again, I'm known as the Heart Lady because what I do is I work with the heart, because I understand that the heart is not only just a muscle and a major organ, but it influences the quality of our health, how we love, and the way we live. And so, as a health coach and a relationship coach, I realized that most of my clients want something more tangible. So as a health coach, I just don't want to just say, oh, well, these are let me hear about your vitamins and giving you all the other coaching to motivate you to do well. I always like to give them something tangible. And I was introduced to this graph or report card of your body. And it really is just telling you about your energies, about the where it is stuck, because where your energies are stuck, what this machine will show you, this is most likely where you're feeling the pain. When I put it on my clients, they're like, oh yeah, I forgot to tell you I do have pain there. Oh yeah, I forgot to tell you I do have pain there. And the graph really has, I even did it to Dr. Z, and she said, oh yeah, I do have pain there. She said the same thing. And so it's a good way to understand where energy is stuck in your body. This is where you will feel the pain. And that's what's good about it. It's very accurate. But also it gives you a nutritional breakdown of what foods are best for you. It also lets you to know the emotional component, because what we feel also manifests physically. And so that is so important. A lot of people don't understand why maybe we have high blood pressure. The emotional component to that is that, oh, maybe they're holding on some anger, some frustration, and they didn't realize when that really stuck in. And every time that they get triggered, that a wall or that block of emotion, it gets bigger and bigger and then manifests as high blood pressure. Sometimes we may have just some shoulder pain or some back pain. And Dr. Z also knows that sometimes it's emotional, and that if it's back pain, where are we not feeling supported? Shoulder pain, what, are we having a lot of burden? What are we carrying that really doesn't serve us? Muscle tension and muscle tightness. What are we tensing up about? What are we feeling guilty about? What are we feeling ashamed about? So our emotions are very much tied, because our emotions release hormones that travel to the brain and back to the body and back again. And so what it is, when you have a good body scan, you're able to see all the areas in your body where the emotions of the energy is stuck. So they have a saying where where emotions go, energy flows. And so you'll be able to see this. And then we also can treat it right then with laser therapy. And then again, it gives a good breakdown so your chiropractor can see what muscles and what bones are really there that they can manipulate and help to give you relief. So it's real-time information, and you can get real-time healing towards it. You'll also get a coach. They will also be able to motivate you and give you some affirmations and give you some other healing modalities that will help you feel your healthiest and your happiest in faster rate than just taking medications and having to deal with some of those side effects. But we're not saying don't take your medication. This is complementary too. So you can have this. It's not going to interfere with any medication that you have. Only thing is that we don't do this on patients who have cancer. All right, so I am going to show you a brief video to say a little bit more of what I try to say. All right, everybody good with that? Ms. Jefferson, you might want to ask your husband to come in for this one. All right, I'm getting ready to share. I guess
Might want to turn up.
We got somebody else on. Yep, I think I'm. Let me turn it on first. That would be smart.
And see if there's anyone in the waiting room.
Yeah, I just let somebody in.
Ligaments, and internal organs. For instance, the small intestine starts in your small finger and flows all the way.
Turn it up a little.
And into your ear. It affects these muscles. And it flows through this internal pathway, which then affects your ear, eyes, neck, heart, digestive system, stomach.
Still pretty low. Hi, Dorothy. The volume is a little low.
No one can hear because I'm up 100%.
Are you still showing your screen? Because I don't see it.
All right, let me try it again.
Okay.
I'm going to start it over for the other people.
It's still pretty low.
Okay. I had it at 100%, so I apologize. Most people, did you hear it or not? Let me know. No one didn't hear it.
Yeah, it was very, very, very light. So
I'm not sure how I'll share. Okay, wait a second. Share computer sound. Okay, wait a second. Let me do that one more time. Now I know, just a second. Let me get it back up.
it's still pretty faint.
Force that runs through them is called qi.
There you go.
Each meridian connects with muscles, tendons, bones, ligaments, and internal organs. For instance, the small intestine.
Okay. All right. All right. So let me see. So everybody could hear? All right. Thank you for bearing with me. Let me just check to see if anybody else is waiting.
In the waiting room. Because we got one more person on, which is good.
Yeah.
Just in time.
Yeah. And let's see if there's anybody else before we start. I don't see anybody else in the waiting room. Here we go.
In traditional Chinese medicine theory, there are many pathways or channels of energy that run through your body. The channels exist synergistically, each of them contributing to the health and vitality of the others. In Chinese medicine, these channels are known as meridians, and the sustaining energy or life force that runs through them is called qi. Each meridian connects with muscles, tendons, bones, ligaments, and internal organs. For instance, the small intestine meridian starts in your small finger and flows all the way through your arm, shoulder, and neck, and into your ear. It affects these muscles and flows through this internal pathway, which then affects your ears, eyes, neck, heart.
And so what we got to see here is these are actually what you would get as a report that will be emailed, and that you can give your provider. So what you're seeing, these lines that are going through is showing you that there's blockage, or that this particular, what we call meridian, this channel, this is where the energy is flowing. So it flows down through your heart, down through your stomach, down through your intestinals. So some people may say, yeah, I have knee problems. And then it can also show that you have some intestinal problems, whether it's constipation or whether it's gas, or also shows you in the back too, where you could also have some pain. So you could have some pain in the shoulder, but it also has been radiated down to the elbow or around the neck. So it's a very full graph, and I'll let you, it'll finish.
Digestive system, stomach, leg, and knee. All the meridians affect different parts of the body, but they're all connected to each other. Your practitioner uses the acugraph system, which combines this ancient wisdom with modern science to electronically measure.
So that's exactly what you'll be holding on to, this particular probe. And this one is where I'm going to be attaching just a Q-tip, and all you'll feel is a moist Q-tip on various parts of your hand and feet. And what's great about it is that once we move it, you'll be able to see the screen as well and see where I'm touching, and you'll learn how parts of your hand and feet are absolutely connected to your organs.
Which then affects your ears, eyes, neck, heart, digestive system, stomach, leg, and knee. All the meridians affect different parts of the body, but they're all connected to each other. Your practitioner uses the acugraph system, which combines this ancient wisdom with modern science to electronically measure the qi in your meridians using acupuncture points on your hands and feet. After your short accugraph exam is complete, your practitioner will show you a chart of the energy in your body, which will indicate where the qi is blocked and how your practitioner can help restore balance and function. An imbalanced chart means that qi is not moving well through the meridians.
And the word qi is energy.
Imbalances, if left untreated, lead to symptoms. A meridian shown in blue indicates deficiency in qi. One shown in red indicates excessive qi. And one in purple indicates that that meridian's qi is unevenly distributed between the right and left sides of the body. Green means that your energy is flowing well and in balance. Based on your symptoms and accugraph's findings, your practitioner will create an effective treatment plan to restore balance and address your symptoms. You will be able to watch your progress from visit to visit. As your graph becomes greener, your body will become more balanced, allowing it to heal and thrive naturally. This will lead to a decrease in symptoms and improved health and well-being in your life. We hope that you enjoy the insight that Accugraph gives you into your unique pattern of energy, and we wish you joy on your journey to healing.
Okay, so looks like we've gotten a few more people in. Welcome, welcome, welcome. Thank you for tuning in. Again, this is Sharon the Heart Lady with Dr. Z, and we're talking about how you can get a report card up with your body. You'll be able to see where the energy is stuck. Qi is a Chinese term that means energy, and this particular device is fashioned off of traditional Chinese medicine, and it really gives you a good idea of the foods that are good for you, where you're emotionally trapped, where you may have pain. So it's great that you can show it to a chiropractor, a massage therapist, all that you can get at Chiro Z. You can, we'll come in and I'll come in and I'll give you the, do the graphing on you. You'll be able to see it and participate, and you'll be able to mark your progress. So it's not just something that we're telling you, you'll be able to see it. And that's what's great about it. And it's only takes about 5 minutes for the whole procedure to be done. And that's about it. We'd love for you to come in and try it. So we're having the introductory prices and gifts, and really be able to show you the benefits. You'll be able to get some coaching on the spot around that. So tell me what you think. Dr. Z, do you have anything you wanted to add with that, since you've experienced it yourself? Unmute yourself. You are still muted, Dr. Z.
There you go. Can you hear me now?
Yes.
Okay. So yeah, I've been getting biofeedback therapy in the past, and being, gone through a body scan, and I see how it's helped me to fine tune what it is that I need to be doing. And, there's so many supplements, so many different things that are out there. People are pushing this and that at you, but really what you need to know is what you need, what it is that your body needs. And so one of the things that I know is beneficial with this kind of energy work is that it's non-invasive. There's no chemical, included in your body, no harsh drugs, no side effects. You can conveniently do it on a visit to the chiropractor. And not only does it give the areas that you are out of alignment, so it actually helps me to fine tune the areas that I need to focus on when you come into our office, because it does have a graph of all of that. It does give you, what are some of the foods based on any deficiencies that you need to start taking. And it does give us an idea of what kind of supplements you will need. So it's fine tunes the things that your body need based on your chi, which is your energy. And as we were talking and looking at that, I'm like, gee, where did I see that CHI? And it's right in the Caro. Well,
oh yeah, look at that.
I mean, come on. So I know I'm in the right place.
Yeah, you are.
Yes, 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 yes. I am so happy to be in a profession where I can help people be their best self. And Ms. Sharon's been doing this for years also. And, you know, together we make a good team to help you fine tune your healthcare and your well-being. You know, not out there trying out this and that and, you know, what you call it, troubleshooting. That could cost a lot of money. So you really need to know what your health report card is. Another thing that's really good with the biofeedback is that it helps to enhance your awareness, your self-awareness, and control and promote a general self of well-being. Especially when you know that, you know, certain emotional things can trigger some physical things in your body. You know, you'll start to learn how to exercise emotional intelligence. And, you know, manage your stress. These are the things that are very, very important in these days because of so much stress coming at you. And, you know, surviving all this is about managing your stress. I was just talking to someone, my brother, like yesterday, and we realized how much energy is so important to the body, because if your frequency is low, which is what this machine also picks up, where in your body you have those low frequency, those low energy. When your frequency becomes a certain level that it's low, that's when the viruses, the bacteria, and all those other low frequency organism or entities start to work on your body. So you want to make sure that anything that's on the low end, raise it up. And you got to know what you need to raise so you can, you know, get that health in balance. So, you know, if you're you know, operating on a low frequency, those things is going to catch you. The viruses, the bacteria, end up feeling sick and tired and all this stuff. Raise your frequency, then you'll notice that you'll exercise, you'll experience more health, more vitality. And even on your sickest day, if you just do something that increases your frequency, you kind of like pull yourself out of the dumps and you start to feel better right away. So,
and you know, it could really be, Dr. Z, you know, the exercise, exercise, we're taking deep breaths.
Yes.
The deep breaths are really the secret medicine into raising your energy, and even when you're feeling pain. So it's the breaths are increasing the oxygen, and the oxygen is able to feed the cells. And once the cells get their nutrients, then you'll start to feel better. And so you're not only just going to get the graph, but as Dr. Z said, you're going to be educated. So you're going to be able to be more aware and think about the triggers that are happening in your body. And so it's not just the feeling, but it's also the things that you are telling yourself, the stories that you're creating, the beliefs that you've held that may not have served you, that may not be true. So it's really getting to the core, to the root of it, because as Dr. Z said, the frequencies are the thoughts, and the thoughts that are traveling throughout your mind, throughout your body. These are the things that are giving you the dis-ease in your body. And so this is what together we are working to help educate you, to empower you, for you to own your health. And this is the difference between alternative complementary medicine. This is the difference when you come to a practice such as myself and Dr. Z. You are truly empowered and get a better understanding. When my clients come to me, I explain to them, what does high blood pressure mean? What does the blood pressure mean? What does the top number mean? What does the bottom number mean? And how can you help to alleviate it? So you need to know a little bit more. We'll stop drinking, eating salt, and start to eat better. You know, that we go to the doctor, they say you need to drink more water, you need to exercise, but they don't show you how to really implement it. And then you don't see where in your body that the pressure is, or the energy has become so low or too high. It could be low, but it could be too high, which is just as bad, excessive. That when you have high blood pressure, what is the energy is really, really high. And when you're feeling very fatigued, It may be because maybe your spleen, maybe your liver needs to be detoxed. All of these things you'll get to be able to understand and see the graphs as well. So I am having great results with it. I'd love to share it with you. Dr. Z, tell them a little bit about your, because I know you're a big fan of laser therapy. So tell them a little bit about how laser helps in with that healing, because that's what we also use, some laser lights that will help stimulate those cells from where the graph shows us that the energy is stuck.
Right. So laser therapy is a non-invasive therapy, cutting edge technology, where it's actually stimulating the cell's little engine. It's called the mitochondria. It creates the energy. It's for the cell. It also helps with DNA synthesis, which is also important with cell regeneration. And so what happens is the different lasers, whether it's red laser or there is the purple lasers, those have different wavelength and they affect the cells differently in whichever energy state that it's put in those cells. And those are healthy states, by the way, healthy. So once we put the laser on certain areas, and of course the body scan would tell us where we need to concentrate on, it actually increases the energy state in the mitochondria and how it goes through its own cycle of producing ATP and all those electron channels that allow the cell to function better. Cells functioning better mean that it's producing energy and it's getting rid of its waste properly and is able to reproduce properly. So when any of those things are interrupted, then you end up having a cell that's not functioning properly, and then you end up with inflammation, and then you end up with, all the other symptoms that come along with it. So the laser therapy actually helps to reduce pain, inflammation. It helps the cells to reproduce properly because it's helping with the DNA synthesis and so forth. So it's almost like cell regeneration. It's not heating, it's not, creating any kind of like massage or anything. No, it's just light. And if light or any kind of light is, I wouldn't say any kind of light, but even the sun rays is healthy for you. The sun rays actually changes chemistry in your skin and creating vitamin D. So the same way that the sun is able to create chemical changes in your body that actually helps with the function of your body, the same way the laser actually works. Yeah. And so we use like the red lasers and for pain and discomfort, or even for healthy cell reproduction, etc. So combining proper nutrition, behavioral modification, healthy lifestyle, and using our laser and getting your report card, all of that helps to fine tune your health and wellness. And of course, giving you back your health, like you're responsible and empowered by helping your health to go forward. Because when you feel like your doctor is the only one that can make you healthy, it's not a good thing, because you feel like, oh, so, something is wrong, I gotta go to the doctor. Sometimes if something is wrong, you gotta change something about you, either your nutrition or how you're thinking, or a couple of those things. And that's where we help you do that and fine tune with the body scan what are the areas that need to be addressed. Because I know I was back in the days before I started looking at body scan, I was taking all the vitamins, I was taking everything. I was like, we cover all the bases. But that's not always good, because it can overload the body. And, you just want to know what it is on the top of your list that needs to be taken care of, because it's all in a gradient. It shows you what's on the top that needs to be taken care of. As it goes down, what are other ones that you need to get rid of? And sometimes, or most of the times, when you get rid of the top stuff, the other ones at the bottom starts to eliminate.
Absolutely.
So, yeah. So it's easier to actually get your health in balance once you know where to start. And I think that is, absolutely important as far as fine tuning your health and wellness.
Yeah. Well, thank you for that. I mean, that was definitely well said, and exactly my sentiments as well from my experience having laser therapy as well. It seems so funny because you don't feel anything. You just see the light and you're wondering, how does this really work? And then within a day or so, you forgot that you had the pain, just like that.
Well, I've used the laser for actually, the patient just left today. He had knee issues. He doesn't even have to deal with that anymore. 2 or 3 visits and he's good. I've had patients with neuropathy from being diabetic. I mean, that's a very painful, when you have pins and needles on your feet all the time and because of nerve damage. And it actually helped him. Some of the time they get so well that they don't need to come back. But I mean, my goal is not for you to keep coming back. I want to see results, see you get better, and you refer other people so they can get better. So again, like Ms. Sharon was saying, is owning your health. I don't want to be responsible 100% for your health. I want you to see how your efforts make your health better. And I'm just remove the interference. That's what we're doing. We're helping you to remove interference. The body scan shows where the blockages are, where the interference are, and we figure out nutritionally how we're going to get rid of that, or emotionally how we're going to get rid of that, or whatever way, Ms. Sharon would tell you how to deal with that. For me, structurally, as a chiropractor, I get rid of the interference on a structural level so that you can, move better, feel better, and remove those interference so those things can flow easily, because structure affects function. So when you put all those things together, the structure, nutrition, and the emotional well-being, that's your balance for health.
That's your balance. That's as I said at the beginning, it affects the quality of your health, how you love, and the way you live. Because if you don't feel good, then you're not putting your best out. And then you start to have all these negative things that you start to think about when you don't feel good. You know how it is when if you're hungry. Let's make it simple. If you're hungry and you're hungry long enough, what attitude comes up?
Right. Exactly.
You start to get angry. Then you got an attitude with other folks.
The emotion definitely helps to get you off track. So it's important to what we call that emotional intelligence. But absolutely. I mean, here for today, like if you are interested and you see where you need to make that step, Miss Simone, our front desk administrator, she's on our call. Simone, raise your hands.
Hi.
All right.
So Simone is right here, willing to get you on our schedule. We are giving a % off for getting on our schedule for getting your first body scan. And being that everybody was on, all the ones that came on time, they have their little gift of health also. And Simone, we already know who those are. And so all you guys need to do is in your chat, raise your hands or type in or text Simone, and she can get you on the schedule as we're talking, so that we can get you going. We're heading into the flu season. We're also dealing with COVID-19, a pandemic where people are sick every day. Some people are walking around with no symptoms. Some people are walking around with symptoms. All sort of stuff is going on out there. We have to make sure that our health is top notch. And once you start to do the right thing, your family will start to do the right thing. Your friends will see you, looking with full of vitality when things are looking crazy for everyone. And they're also going to want to know what you're doing.
They'll see the difference. That's right.
Yeah. This is a time to do it. You don't want to wait when we're in the flu season to start working on yourself, because you want to be going into it ready to go with your report card in one hand, and you've already checked off a few off the list. Isn't that true, Ms. Sharon?
Absolutely. Once you become aware, once you become educated, there is no reason why you can't hold your health in your own hands And it's about being proactive about your health, and it's also about prevention. So even if you were to get sick because you were doing certain things, you won't get the full effect, and you recover quickly. So you'll recover much quicker if you start now understanding what things that you need to do in order to maintain the strength, and maintain increased immune system. So that's what we are. You know, I see, Simone, that you put that you get 20% off of your first visit. How about, can I raise the stakes?
All
How
right.
about that? What do y'all think? Should it be 20, 25? How about 30%?
30% sounds good.
30% is a good. So 30% off if you make an appointment today.
That's good.
And you can tune in and talk to Simone for what your 30% rate will be if you sign up today. And I'm feeling so generous that if you refer someone else, you may get an extra discount. So give us give Simone a little chat, or tell her to call you, and she'll be able to go ahead and discuss what your
Miss Sharon, you're really generous today. That's an awesome, that is, you know, let me tell you, you can't put money on your health. There's a lot of people line up in hospital right now, can't breathe. They would do anything. They could just catch a little extra air.
Yeah.
And you know, and had they known, some of them, it's not their fault, you know, they caught it from family or whatever. Maybe their immune system was low, or, you know, I don't know, you know, this thing, nobody knows what's going on, how it's affecting the body. It's like very new. Even doctors are, you know, they've been saying, oh, it's COVID, it's this and that. Some doctors are saying, this looks like not necessarily upper respiratory, but it may be affecting other organs. So they're still figuring things out along the way.
Yeah, and I think that even though they may not know all the nuances of the virus, if you just go with what a virus is and how to heal and recover, and what things to do to prevent getting the worst aspects of the worst symptoms, the worst conditions off of the virus, you're still going to be that much better off. And so it's not just about that. I really want to stress that you'll also get the 3 parts of it. You'll be able to know what's going on in your health, what's going on emotionally, and being able to talk about and work through that, because our feelings, how we feel, our emotions transfer or transport in and manifest on the body. And this is where you get your aches and your pains. So you're going to get, this is what we call full body whole, WHOLE, right? Holistic healing. So it's full body, and you really can't get that much in anywhere else. And it's not about how much, it's about why wouldn't you want to invest in your health first? Take care of yourself, and then you can take care of everyone else after that. But you got to have the strength, the stamina to go through what we're going through now. And remember, the virus is not just about the symptoms of feeling sick. It also makes people feel depressed and feel sad. And then they say you can't go out, and you can't touch, and you can't hold. All of these things create more stress in our body. And the inflammations is what also causes the stress. And knowing which vitamins you do need, or what type of nutritions you do need, the vitamins, getting some expert advice on which type of vitamins, because there's vitamins in the health food store and there's vitamins at Kroger, right? And so you need to know which in your local supermarket. So whoever people may not know Kroger, right? But your local supermarket, there are different types of vitamins, and some of them have fillers, and some of them are whole foods and are much healthier for you. So you're gonna get, when you leave, you get full value. All right, so I'd like to open up just before, we got a couple of more minutes. We promised that this would be about 45 minutes to 60. Are there any questions about the device, or any questions that we can help you with right now?
Unmute yourself. Any questions? Yeah, everybody's on. No, nobody. Anyone?
Hello, Dr. Coleman. How are you?
I'm fine, Pamela. How are you?
Absolutely wonderful. I love everything you're saying. I have had hypertension for the past 28 years, and it's hereditary. So
Yeah.
can you help individuals who's had it for a long time?
Yeah, well, you can manage it, of course. I mean, there's obviously something that's triggering that, and that's why the body's important. Because even though it may be, you know, genetic or familial, manage the hypertension naturally. Would you say that, Sharon?
Yes, definitely. We can't, we have to put the disclaimer out there. We could never say that you're going to get rid of it. But I definitely have had many clients who have been on 2 and 3 different types of medication for hypertension and have been able to wean off. And so wean off significantly.
Right.
So it really depends on the work that you want to put in and how serious you want to take your health. And I'm not trying to say that you're not taking it seriously, but there's a lot of things that your provider may not have been aware of or not told you, or you may not have had a coach that is able to motivate you and work with you and get to the bottom of it. Because I guarantee if you've had it for that long, there is something emotionally behind in your core, the reason why it is still staying up there.
Okay, great information. All right, thank you. Sounds brilliant.
Thank you, Pamela.
And there is certain emotions that actually triggers hypertension too. So, you know, even just nipping that in the butt could help.
Yeah.
You know, I'm sure, you know, I know Pamela, she's strict on her diet and so forth. So, you know, we could probably help you with just getting the body scan and seeing what other areas, because, you know, hypertension could come from a slew of things.
Yes.
And, you know, it could be a kidney issue, it could be an arterial issue, it could be a heart issue, you know, so many things. So fine tuning and figuring out what that is with the body scan. And like I was saying, like, you know, when you see your scan, you see these graphs, and, you know, it will tell you which one you need to work on, the first couple of ones that are high. And sometimes when you start working on those, the other stuff start to diminish. And they may not look like they have anything to do with hypertension, but because you're creating homeostasis, bringing the body back to balance, everything start to play its own tune, and it's balanced. So, you know, that's basically, you know, what that's a great question, by the way.
Yeah.
A lot of people have hypertension, and you know, want to know how to get off some of these medication, you know.
And we as Black women, we are definitely on the highest rate of those. And so it is definitely our passion to help where we can manage it, and learn about all the stresses and what we can do to help not pass that on. So there's a lot of information that we can, you know, it's also been proven that even simple things as meditation. And there are different types of meditation, because everyone thinks of meditation being in one place. And however, there's many different types of meditation. A prayer is meditation, and walking, there's walking meditation, there's focus meditation. There are different types of meditation. And even if you were to do it for a couple of minutes a day, even learning how to breathe is a type of meditation. So these things are definitely will help in getting the body less stressed and helping you how to anchor yourself. And that will also help decrease the blood pressure.
Yeah. Any more questions? Amelia, Miss Dorothy?
Monica?
Yes, this is Anita. I have a question. Say if you do recommend supplements, will we be obligated to purchase the supplements from you all, or as long as we're taking the supplements? Like, say if we already have supplements here at, you know, at home that we are currently already using.
Good question. I don't sell supplements, so I know a lot of these body devices come with where they suggest that you buy this. There are some suggestions, but definitely I'll work with you. I'm not sure, Dr. Z, do you sell vitamins?
Well, yeah, we do have supplements.
Yeah.
But, you know, what we will do is teach you, if you are using from another source, how to choose a good supplement, because
Yeah.
not all supplements are equal.
Equal.
So like Sharon was saying earlier, some of the supplements, they might be like $4 in the dollar store, you know, or in supermarket, but they're filled with fillers. So we teach you how to read the labels,
Yes.
how to check and make sure it has what you need, so that you get the results that you need.
Yeah.
But you're not obligated to buy anything. Our goal here is to get you educated, be more aware of where your health is, and of course, you know, have more control of your health, so that when you get those results, you don't want them to be any better but best, right? So, you know, we want to make sure that you're in control and of your health. Great question.
Yeah,
great question.
That was a good question.
Okay. One more question.
Yeah.
Oh, sorry. Go ahead.
Go ahead, Dita. Go ahead.
Okay. My other question was, will we be coming to you, Dr. Z, or will we be going to the heart doctor to get the exam?
You'll be coming to our location in Conyers, and we can schedule you. Simone is on the line now. She can schedule you now to fill in any slot anytime that you want to come in.
Yeah, I was just communicating with her, but I don't get off of work until 5, so I won't be able to come until anytime after 5. Or I could possibly do a Saturday. Is that a option, or can you do it like after 5?
Well, is Saturday good for you, Miss Sharon?
Yeah, I do Saturdays.
Yeah, Saturday is good for us. So Miss Simone will try to get you on a Saturday.
Okay, cool. I already sent a message that I was interested. I just wanted to, you know, see about the time frame.
Yeah, we'll work with you. I mean, we do have a set time that we do it, because, you know, we'd like to make sure that we get, you know, everybody in between when I'm working, doing other things, and Sharon. So we'll definitely get you in. No worries.
Okay, cool. Now, I think I have an appointment for this Wednesday, I think, for a massage.
Okay.
Will I be able to do it after that, or I just need to schedule for a Saturday?
Schedule for Saturday. We don't want to have massage in the mix of your body scan.
Cool.
We'll see where your body is without all the extra stimulus.
Gotcha. I'm with it. Okay, thank you so much.
All right.
Okay.
But talking about supplements, I have to talk about Dr. Z's clean out pills. If you all don't have these, then you need to get them, because they are the 100% truth.
Yes. Let me tell you, I can't keep those on the counter.
I buy them for my friends, okay?
Yeah.
Oh, wow.
My question is, so if we get the body scan, what do you suggest, Sharon, would be the length of time before you get another one? I know everybody's probably on their own individual plan, but what would you say, your professional advice, when we should get the second one to see that we're progressing?
I say within at least 2 weeks.
Okay.
Within at least 2 weeks, because you want to make sure that you'll feel good and you'll know that you're progressing. So within 2 weeks is what most of the providers do. Yeah. Okay. All right, those were excellent questions.
Miss Dorothea, I don't know who is this in the 770 number. You want to unmute yourself? So 0726, who is this? They're just listening in.
Okay, they want to listen.
I'm not sure who that was. This is Dorothea Williams.
Oh, hi, Dorothea.
Hi.
Dorothea was the first one to sign up. She's like, make sure I'm in. I want to be number 1. So that's awesome.
Thank you.
Yeah, and I wanted to be the first on the call tonight, but I don't know how to work my technology, and I have a new phone.
Oh, okay. Well, you got it today, so that's
got
good.
it. And I don't totally empathize with you, because I was having little issues on sharing the video.
Yeah, I just heard the question about how long you should wait in between the sessions, but is there a certain set of sessions you should have, or does that depend on the individual?
It depends on the individual. We always say, and most of the providers who use this equipment try to do it in a package of 6, but I say invest in at least 3 sessions. and you will know. You will know. You will know. But 6 sessions, depending on what's going on, after,
Right.
you know, you may have 2 sessions and it's like, wow. I
Exactly.
remember I had my first laser session and the provider couldn't believe that I was healing so quickly. And she said, well, let's just do one more just to make sure. And so, it just depends.
Okay, thank you.
You're welcome.
Yeah, it depends. And you know what too, like once you start working on, once you've got your body scan and there is some suggestion of foods that you should eat and all that.
Yeah.
All those are going to help with your healing process. Once you start working on yourself,
Yeah.
from there, you're giving your body all the building blocks for it to do its healing.
Yeah.
So, it all depends on what you're doing and, how aggressive you're going at it to get the results.
And where your body was
And where,
beforehand.
exactly.
Yeah.
So I usually, for me, if you're on a supplement or if you're just getting started on a supplement, I always say, give yourself at least 3 months.
Yeah.
There's the body kind of got to cleanse, get rid of the inflammation, the this, the that. And then we got to, put back what your body need, replenish. And that's where the supplement comes in to replenish stuff. And then experience the revitalization.
Yeah.
Closer to like, 2nd, 3rd month, you start to feel the renewal.
Absolutely. That's true. Very true.
You got to give yourself.
Because, it's very true. Because even if you were put on medication with your provider, it's 3 months before we can really know that it did take effect. Even if it's someone who is diabetic and they had their A1C, they're not repeating that blood test to really make sure that you have been your body is adjusting. It takes about 3 months. So 90 days is a good way. Even if you're someone who just want to lose weight, you're not really going to see the effects until around 3 months. So it's not something that you rush into. It's something that you learn more about yourself, you educate, you keep on coming and do what is necessary.
Yeah, but if you're doing therapy, like the laser therapy mixed with the the instructions from the scanner, like you were saying, Shannon, 2 weeks just to see how you're doing, how your body is responding, because we're watching these things and seeing, as your practitioner, that's what we do. We're monitoring on these follow-ups to see if you're heading in the right direction.
Right. And so I'm glad that you made that distinction, Dr. Z, because it's you have it and then 2 weeks later you want to see where you're at, but that doesn't mean that you just stop there. It really does take a couple of months, at least 90 days, just even to have to establish a habit, right? 21 days to make sure that you're getting it right. So, but it's within every 2 weeks, you really want to be able to see how you're progressing. And that depends on where you started from and how much and how proactive you have been. So it is 8 o'clock. I want to really give a special thank you to those that came on today and those that came early and are diligent and those that know that there is no value that you can put on your health. We are going to have another Zoom, so we'd love for you to Zoom intro webinar. And Dr. Z and I will, I think it's going to be next Monday again, I believe. So we would love for you to share the information, and especially those who we get to see before the next Zoom. Maybe we can get some great testimonies from you.
Yeah. Well, I really am happy that you guys came on today. Everybody that's supposed to be on today is on today. And I know that energy is going to help you reach your goals, and just share that energy with other people. Remember, as we get off this call, is to try to keep your energy level high no matter what, because that's how we're going to, stay above the other stuff. So do you want me to close out, or, are we good, Miss Simone?
We're good.
Yeah. All right. So thank you guys for.
Oh, let's give a special thanks to Simone for being our
I
backbone
know.
there, our techie. Thank you so
Thank
much
you.
for that extra time, Miss Simone.
Yes. Yes. Definitely Simone is putting some extra hours in today. But she, she herself understand how it is healthy to, important to keep your health. And we're gonna try to make sure that we're there for you guys on your appointments. And so once you've tap into Simone, let her know when is good for you. We'll make it work out for you. And then hopefully by next time we talk or we see each other, we'll have some great testimonies on how this experience was and how, what you're experiencing from that point. And so thanks again for tuning in to our health talk. And I'm going to let Sharon, you can go ahead and close out.
Well, we are so thankful. Get your report card. Hold on to your health. That is your true wealth. That is where your power lies. So I'm asking you all to, what you've heard it said, if you don't get help here, get it somewhere. But we know that that you trust Dr. Z, and I'm sure that you will find that working together with us, because we really, really, your health is our priority, and getting this out to the community and to our people. This is a passion of ours to do and to share. So thank you all, and may you all have an absolutely wonderful week. Take care now.
Thank
Love you
guys.
all. Be blessed.
Be blessed.
Thank you, ladies. Love you too. Bye.
Bye-bye.
Bye.